CoC.
Michael Chalaza, Perk.
Victoria Kelly, Homeless Leadership Alliance of Pinellas.
Sam. Want to just introduce yourself? We're glad you're here, Sam.
Sam Picard, Miss Sierra Day.
And then Michael is Michael signing in.
Michael, do you want to introduce yourself to everybody? Michael, you want to introduce yourself to everybody?
Yeah. Okay. Michael Creighton's with our lived experience committee. So, all right, and then
And
Victoria.
this is Edie Erb with St. Vincent de Paul Cares.
Hello, everybody. It's Mick Constantino. I'm the HLA board director.
Good morning, everyone. Esther Matthews, Supportive Equity Connections.
Fantastic. Because I think we have so many online and we have a tight schedule, Victoria, Victoria's going to read through them real quick for us. Thank you.
Okay, yeah, online, we have, some of them were already introduced, but we have Alex Strider, Arrow Woodard, Camille Henry, school board member Caprice Edmond. We have Sherry Holtzbacher. We have the community law program is joining us. Dominique Randall, Edie Erb, Esther Matthews, Grace Peyote. I apologize, Grace, if I mispronounced your last name. Imani Smith, Jessica Unch, Jessica, I apologize, I just mispronounced your last name. Michael Pavelka, sorry, Michael. Mick Constantino, Monica Cordry, Monica Orti, Renee Flowers, Zen Boylan, Tatiana Arnold, Victoria Saylor, and William Kilgore. Oh, and Commissioner Renee Flowers.
Thank you. So thank you all for being here. Today, this is an exciting meeting with a presentation of the results from January's pit count. Yes.
Madam Chair, point of order, do we have an in-person forum?
We have our executive board member, Commissioner Deborah Big Sanders here today. Thank you. Victoria, do we have a forum here? Forum 11?
12. And that brings us, I think, just one shy. We are one shy of quorum, right?
One shy. All right, well, we can continue on until the action items.
I do believe Sean said he would be joining after 10. So he should be here by the time.
Sean, after 10.
By the time we take action.
Okay. Okay. Thank you. All good, Teresa? Me?
Till we get to
Yeah.
action, if we get to action and we don't have a forum, we can't take action.
That's correct, yeah. But I mean, we need the information on the pit count. I think it's important to continue.
I'm
meeting.
sure, I'm just
Yeah,
want to keep us in order,
Yeah.
that when we get to action items, since we don't have a forum, we cannot take
That's
action. It's only information.
Yeah.
Thank you.
yeah. Donna,
I just have a quick request because I might have to leave early. The discussion part, if we could just switch the camping legislation and the diversity equity and do the camping one first, because I know we have that coming up at our meeting, so I just wanted to get this information from here as I could.
on the anti-camping legislation?
Yes. So I was just asking if we could just switch those to the order that those are.
I don't have, does anybody comment about switching those? Oh, good, okay, sure, we can do that.
Thank you. I mean, I may still be here, but I just.
Okay.
Thank you.
And if you need any other information, please reach out to me.
Okay, and I know I can help you and Carol as well, but. Thank you.
Absolutely. Great. All right. So all the work that goes into the point in time count, all the organization that Victoria and her committee do each year to organize hundreds and hundreds of volunteers to go out throughout the county. We have hit numbers in, and that information is going to be produced or discussed by Timothy Freeman Gearhart, who did the presentation last year as well. Did a great job. You want to come on up front and
I'll go first.
yeah.
Do you already have the slideshow?
Yep, I'm gonna pull it up right now for you.
And all this information will be available to you after the meeting, so we'll go through the data, have any kind of questions and answers, clarifications, how it compares to last year's or previous years. And then we'll take a vote whether or not to confirm or accept this report.
So I guess I'll just tell you that.
Can you tell a little bit about yourself and
Sure.
how you're doing?
Well, first of all, I apologize for my voice. I'm returning from a trip, so I'm in the process of losing my voice. It's not COVID. I did the at-home test, so I don't know. I'll stay away from people. But my name's Freeman Gearhart. Last year I gave the report as a PhD candidate, and now I have my PhD, so. That's right, Dr. Gearhart. Still weird, so. But yeah, so, I guess that's probably all you need to know about me. I'd like to jump into the report so we can have time for discussion, but have you guys had a chance to read the actual report, or has it been sent out?
Yeah.
Oh, you did, perfect. Okay. How many people have actually, I would say skimmed it. It's a long one again. All right. Well, so this presentation, I'm gonna try to condense it to as short as possible, but as those who looked at it, I think it's like 140 pages. So I might go a little bit quickly, and then at the end, we'll just have time for discussion, question and answer, but preferably discussion amongst everybody. All right. Okay. So in the presentation, I'm just going to kind of go over briefly the methodology, some of the key findings, some of my recommendations, and once again, time for Q&A. So a little bit about the methodology. The housing inventory count is separate from that's the sheltered count. So then there's that's the count of all of the provider organizations. They submit the data at the point in time in January through the HMIS system. And then the point in time count is the unsheltered count. That's where people go out and survey the community in person. And the sheltered and unsheltered comparison, I put that in there just to remind everybody that if somebody was counted in the housing inventory count, but also the unsheltered count, they were then counted as in the housing inventory count, so it wasn't duplicated. And then the jail, this is also included in the report, although this is not part of the HUD standards, but it provides a comprehensive picture of the community. And this is, Lieutenant Hayes will definitely correct me throughout the presentation. This jail count is actually people who reported that they did not have a permanent address at the time of booking. And then the Pinellas County School Board, once again, is not part of the HUD standards, but the school board actually was very kind enough to provide me with the data to count the number of people who were identified as unhoused, but this is a little bit different. It wasn't the point in time. It was from the start of the school year until the time of the point of count, so in January. And what I did was I just did some descriptive stuff. I made a bunch of, what I mean by that is I just made a bunch of charts to make it a little bit easier to see. And then some geospatial stuff. I made some maps so people could actually look at the locations of where people were surveyed at. And here is the overall findings, and I'm going to get throughout the presentation, I'm going to get much more specific into each type. I'll get much more specific throughout the presentation of the specific types of housing. But in total, in the housing inventory count, the people who were sheltered, there was 1,389. There was 721 unsheltered for a total of 2,110 by HUD standards counted as identified as experiencing homelessness. And within the Pinellas County Jail, there was 152 people who did not disclose a permanent residence or address at the time of booking. And then in the Pinellas County Schools, there was 3,555 people, students. All right, so to get a little bit more specific on the housing inventory count, I broke it down by, throughout the presentation, you'll see a kind of a common theme. I break it down by gender, race, age, and also I include chronicity in this. But in the housing inventory count, most of the individuals identified as male, white, and then between the ages of 55 and 64. And for the ages, I also, later on in the presentation, I separated it out by 62 plus as well. Next up. So I will go over what I find to be some of the key highlights, but I wanted to include several different graphs in here. What I find very interesting is the difference between households without children and households with at least one child and one adult. So households with children. We can see that most people in households without children identified as male. But when we shifted down to households with children, those numbers changed to mostly individuals identify as a woman or girl. Next slide.
Can you go back on the previous slide? Or I'm sorry, yeah, that one. The households with only children younger than 18. Again, they're like primary happiness. Okay, thank you.
And also, probably should have clarified, ES, emergency shelter, TH, transitional housing, SH, safe haven. So I broke that down. And if you guys, how much time do I have to present?
Until 10.
Oh, so then actually, if it's convenient for you guys, then if you want me to pause and we could maybe
Yeah,
have
what did you say TH means?
transitional.
I have a question. So just to clarify, the households with only children younger than 18, there's only 16 of them? Sheltered?
Shelter. Are there any more questions?
Are there questions online at all? Victoria, are you monitoring them?
There are not questions online yet. I apologize. I was not monitoring for questions until the Q&A section, but I'll do
Okay.
that.
And I have a question related to that item also. So the question is related to the scattered site emergency shelter for families. I guess the question is, what is transitional housing? Can someone clarify what is captured in that category?
Grant per diem,
I'm sorry?
a lot of the grant per diem.
And a lot of the grant per diem, there's also kind of permanent support. Or does it count as only
I don't think
transition?
it's categorized.
I was gonna say, when they're permanent supported housing, that they're not considered still homeless.
Right. Most of them don't have leases like that.
Yeah, I mean, I have my definition of transitional, and I have the HUD definitions.
Well, I would question the author of the study, what did you categorize as transitional housing?
It was what was provided by HUD. So they had, there's a data system that provided me with all the data. It was already pre-classified. So I think I might defer that question to.
Yeah,
maybe
sure.
to
Is that-
or
This
Cindy.
is transitional housing as defined by HUD. Cindy, do you mind giving that
Yes.
definition? Thank you.
So according to HUD, and I'm gonna read it straight up. Transitional housing refers to a supportive yet temporary type of accommodation that is meant to bridge the gap from homelessness to permanent housing by offering structure, supervision, support, life skills, and in some cases, education.
And with permanent supportive housing, it's a lot more wraparound style. More expensive case management with that. That's a good question.
Do you have a glossary in the report that defines all that?
Yes, I have some key definitions, but I also have a link directly to HUD, the website, for all the specific housing classifications as well.
Okay.
And so the reason I was asking those questions, because I'm trying to determine where, I know the city of St. Petersburg provides funding for scattered site emergency shelter for families. And I'm just trying to figure, are they in the middle category, households with at least one adult and one child, where it appears to be a much higher number, 410, is that correct? So I'm thinking that must be where they are.
That should be right, Teresa. When I first read through this report, it caught me the only children younger than 18 is such a small category, because that's unaccompanied kids.
Mm.
Whereas the families with at least one adult and one child, that's most of what we think of as family. So I think that should probably be emergency shelter.
Thank you.
So that households with only children younger than 18 is just a.
There's no adult
unaccompanied?
there. There's no adult, right?
So maybe this will clarify too. So there's youth, which is 18 to 24, and there's child younger than 18. Yeah, and also, if you do have the report open, I have a comparison to last year, to look at the numbers so you can see the change in the appendix.
I have the same question about the family bridge, like where where are those families represented in this particular report and categories?
The different, so these categories, this is the count, and it comes from all the different provider types. So you could
Right.
also see that in the report, so where each of the accounts come from by the specific shelter type,
Okay.
by the organization as well. So that may give a little bit more clarity on that. But I think maybe like these nuanced discussions, we should probably save to the end, because there's several.
Yeah,
more.
and I was gonna, let's go back to to the full report, and then if people can jot down questions, and then as we go along, we can go back to the full questions, so we can. Please, I hear you. Come on in, yeah. We've got this over here.
All right. Let's take one.
All right, so we'll hold our questions to the end.
Well, I think it's okay to, but the very
Yeah,
specific
I-
nuanced ones.
More of a question as we go
Mhm.
person. But we do want to make sure we get through this.
Yeah, there's a lot, so. This is, so same, housing classification types, but instead of gender, this is race. So a similar pattern kind of emerged, which is, so yellow would be people who identified as white. Households without children, mostly were, people who identified as white. But then when we go to households with children, so with at least one adult and one child, we can see that race proportion changed to most of the people identified Black or African American. And so that same pattern emerged throughout the different housing types, as well as by the different shelter types. So there's the housing types, which would be households without children, households with at least one adult, one child. Then there's the shelter type, which would be emergency shelter, safe haven, or transitional housing. Okay. And this is broken down by age. And we can see here households without children. It's a steady increase to where we see most of the people within households without children were 62 years old or older. And then when we look to the specific breakdown of households with children younger than 18, we can see that a pretty sizable proportion of these children were younger than 5 years old, which is definitely something to look at.
So then there is an adult in that household, because on the previous slide, you said that category was no adults, there was unaccompanied.
Unaccompanied, so remember, youth is 18 to 24.
Right, but the previous slide. The two on the right, are they,
These two?
how do they, the two on the right differentiate?
These are children who are 17 years old or younger.
Only, no adults. in it.
These, yeah, so because by definition, they're younger than 18,
So
so
there's no adults in that house.
no adult whatsoever. Technically, there's an adult in this household because it's 24 years old and younger. Youth is classified as 18 to
It's
24.
unaccompanied, so that would imply there's no adults.
Right.
I'm really
Unaccompanied.
confused between the two.
Yeah.
This is, yeah, this is
That's
the
why I asked
terminology
that
by
question.
HUD, so I'll try to clarify it as best as I can. Youth, once again, is someone who's 18 to 24, so they don't have someone else within that household who's, we could say maybe older than 24, if you want to try to get categorical like that. But it's children, youth,
Young adults.
young adult, youth and young adult would be,
They're
yeah.
legal adults.
They're legal adults, exactly.
Mhm.
That's
Oh,
right.
the
Classified as
unaccompanied youth,
unaccompanied
this
Is
legal
legal
adult.
adult, 18 to 24.
Well, that would be helpful to put the 18, whatever the time
Yeah.
age, for the average
Yeah.
person reading this.
Right,
You're not gonna know what an unaccompanied
Right.
youth is by definition.
Yeah, that's why there's the link to the definitions. These are HUD, so it confused me last year and this year as well.
I would put the ages on there because the media is gonna get a hold of this.
Yeah.
When this goes out.
That's, yeah,
Yeah.
I agree.
We do refer to anyone over 18 as a youth.
young youth, young adult, yeah, but that's HUD does.
Yeah, that's.
That's what, we may not, I completely agree with you guys. We may not, but HUD does, so that would be maybe a committee decision.
That definition has been standard for a long time, the unaccompanied youth are 18 and 24. It typically is encompass those that are aging out of foster care and those that may have gotten kicked out the house at 18. So that definition, but I think that adding it on these charts might clarify for those that are not accustomed to that term, applying to individuals that are 18 and 24?
I have a list of key terms at the beginning of the report
Okay.
as well, but maybe that could be something. I think once you look at it, I'll let you guys decide which would be best for the community, but having a link under each figure, I think I have 200 something figures. So it might get actually a little bit more confusing to keep looking at that link.
I
That's-
think for a
that's good.
title, we need to, I mean, when you have a title on a chart, I think it's really, my opinion is, when you have that unaccompanied youth and they're young adults, I think a parentheses 18 to 24 years is a must. It really, people shouldn't be having to click on a link to go get a definition of it
Yeah,
because,
especially since the one above it does have an age
yeah,
younger than 18.
yeah.
Right.
And so to avoid confusion, putting 18 to 24 there probably would.
Once
help.
again, I'll refer you to the very front of the report where I clarify that throughout, but that could be something that could be a stylistic point of order.
Do we have consensus that it's a must to have it on there? I mean, anybody, I think it needs to be changed. So before we release that to them, put it on a website or whatever we're gonna do with it as far as the community, I want it, I think that needs to be right there. It's an easy insert, you know.
So for the remainder of the presentation, just pretend that's.
Yeah, we'll all remember that.
Can you go to the next slide?
Well, wait, can you, yeah, I have a question. So you're saying that households with children younger than 18 is unaccompanied youth. So we have unaccompanied youth that are 6 years old? Is that what you're saying?
Between the,
That's
for,
above there. I'm assuming that's like
which chart?
15-year-old living with a 5-year-old.
Yeah.
I can't imagine.
Right, I
this is
guess.
the
The bottom
5-year-old.
the bottom right, the bottom right, yeah,
Households with children younger than 18.
yes.
So the three categories would be younger than 5, between 5 and, so nobody between 5 and 12,
Okay,
and then 13 to 17. All of
right.
those.
So you have, so there's 7 kids younger than 5 that are unaccompanied?
There,
Well, they're probably living with the 13 to 17-year-olds.
No, this is 18 to 24.
it's, so
Are they
I'm
on their
just trying
own?
to
Are they on their
understand.
own? Are they on
they're
their
on their
own?
own.
So there are children.
These are
that
sheltered, yeah, sheltered,
That are on their
on
own.
their own. Yeah, so it's the surprising point. More questions about that? I see the shock in the room.
5-year-olds that are in shelter and.
Younger than 5.
Younger than 5 and they're unaccompanied.
They're in a shelter, so they're gonna be accompanied by shelter people in the shelter.
That's.
They don't have a family.
This is where I
I
think
don't
we're
know a
getting.
shelter that we have that
Yeah,
has a
this
child
is
in
a-
there.
Yeah.
It would be like a foster,
No,
it
they'd
would
be
be like the
foster.
foster system.
Okay, all right.
Yeah, but that's a ton. That's a lot.
Yes, a lot more than.
That's a lot more than 7. I mean, I'm a guardian ad litem.
I don't know a shelter in our
Some error here.
system that has a child that's not with a parent. Meaning even if they're a teenage parent, or there's
Well,
no
that's a
shelter
fair
that has a
question.
child under 5 in there without,
We don't have
without a
shelters
parent.
like that.
No, not here.
So there were 2 questions online. Errol Woodard asks, would that be Alpha House with teens and new babies?
Oh,
And then Dominique also had her hand up.
It's the same question though,
That-
right?
That's,
To agree with
that's what I mean, they might have been with the 13 to 17.
When Dominique says, I agree with Teresa, that we don't have any shelter that's got a child under 5 in there by themselves.
I'll go ahead and speak. I think Family Resources, they start at 10, but they're no longer putting in their minors that are coming. But HMIS could probably speak on that more, but that's probably an outlier where maybe a baby or something wasn't added or joined the family and then wasn't added to the household correctly. We wouldn't know without looking at the raw data, but that would be an error would be my guess.
Well, it is transitional housing.
Right, but Alpha House has parents with children.
Yeah, but the parents are
Are
13 to
under
17.
18. Yeah.
The parents are 13 to 17, so what you have here is a 16-year-old
Yeah.
with a baby in Alpha House.
Yes.
I
Right, but
understand that.
they're
The
with their
question
parents.
was related to, that he said that if there were children under five.
That's where they were.
Yeah, but it doesn't,
Yeah.
it doesn't
Yeah.
apply to
Yeah.
the 5-year-olds by themselves. 5-year-olds could be with the 13-year-olds.
That's what I asked to clarify, and that's what he said, that yes, they were on their own, so that's what I'm trying to clarify.
Well, how about, so can HMIS, so answer this, clarify this for everybody? Is maybe Tony on board or Cindy? How the count with the household types?
So I can weigh in, but if HMIS is available too, I would ask them to. But my answer to this would be like Kevin said, there are some families that were identified where the parent is under the age of 18 and their child also then of course is under the age of 18. And that is where these would fall into. So they don't have an adult with them over the age of 18, but they might have a parent because they're 2 and their parent is 17. So they are a household, they are a family, they're just a very, very young family.
We do the property maintenance for Alpha House, and so my maintenance guys go in there all the time to repair things and I know for a fact, you have the little 5-year-olds with 16-year-olds
Yeah.
living in there, and they are considered transitional housing, so it's the only explanation.
Yeah, I just think as long as it's clear.
But that is confusing because it's, people would look at it and think that you've got a little 5-year-old
Right.
sitting there all by
Yes.
themselves, unattached, and they are attached, they're just
Yeah.
attached
To
over
another
here.
child.
This is new information from any prior report, so I broke these down because all the other point in time count reports that you guys have read over the past 10 years, I just said younger than 18.
Yeah.
So I wanted to actually have this type of conversation here, so my scheme is working.
It is,
I can
it's
say.
good to know that nuance and really to be proactive in making it as easy to understand for the public. I mean, we have to discuss and get clarification. It needs to be on those
Right,
headlines.
and I don't know about you guys, but more and more in weird settings, because people know I'm on this board, I'm actually getting asked questions each year a little bit more and understanding a little bit more of the nuance on that. I don't want to say, oh.
But it's good to know.
Yes.
Yeah.
Exactly.
Absolutely. Good morning, April. We're glad you're here.
All right. So for the remainder of the presentation. That one. Okay, also, I wanted to break it down, so not just by gender, race, age, but also by chronicity. Once again, the word for word definition of chronicity is on the, I think, second page of the report. So we can have a discussion about that afterwards, as I see the theme emerging. But what we can see is households without children, 18 and up. Green, chronic, so that's where most of the people who are identified as chronic are. It's the single family house, single households, no children, single adults. I feel like I should offer the questions now. Next slide. Okay, and here are the trends over time since 2016. You may notice that 2021 is not in there. The count wasn't conducted, obviously because of COVID. But we can look at the trends by the different shelter types, so emergency, transitional, and safe haven. And we can see that it's been a relatively steady trend for transitional and safe haven shelter types, but a little bit more rocky for the emergency shelters. But ultimately kind of the same pattern, which is most people who are counted in the shelters are residing within an emergency shelter. And compared to last year, which is an exciting point, is that there has been a decrease. This is the stuff that I enjoy doing. If you guys have your phones with you, I made a map to actually look at the specific locations of where the people who were unsheltered were identified as or were surveyed at. Maybe I'll give you guys a minute to look through that. And when it pops up on your phone, you can actually, it's interactive, so you could zoom in and it'll show you the count and it get more specific as you go. And then I also have maps on the next slide to look at. Okay. And then so, actually, one second.
Oh, did anybody else still need? Sorry. Did I pull it too fast?
This is the count within that area, how many were counted? Tell me what these numbers are
How many were counted during the unsheltered count at the point in time?
in that area.
So this
Okay.
is, yeah,
Got it.
in Pinellas
Perfect.
County, yeah.
Okay, perfect.
Mhm. Yep. And you could zoom in on, yeah, can people online see it? Well, here, let's go to the next slide. So I'll show you guys,
It's
some of.
pretty consistent in what's been.
Sure, yeah, it is.
So here's a different breakdown of the locations by the frequent area of stay. So during this survey, one of the questions is where do you spend most of your time? Essentially, that's the question. And we can see that most people report the city of St. Petersburg. But when we break it down by zip code, it gets much more specific to this certain area of St. Pete. And then when we break it down, this is the location, right? So this is where the actual survey was administered. But you can see that in the city of St. Petersburg, it's a very specific area. And then these are heat maps. Or this is a heat map that shows the actual specific breakdown by the latitude, longitude coordinates. So very, very specific. And once again, this follows this pattern of the city of St. Pete, and then as well as Clearwater seem to be the hotspots. And next slide. Okay, so the same pattern as the housing inventory count, the sheltered count, I'll follow with the point in time count, the unsheltered count. We can see that most people who were identified during the point in time count, which I do want to maybe preemptively say that this isn't a perfect count. It's nearly impossible to count every single person in the community. And this year there was approximately, I think there's 395 volunteers, and their task was scouring the entire county. And so you just can't count every single person. So I do want to say that it's not perfect, but it's what is used across the whole United States, and it's the standard. So some of these numbers may be not necessarily representative, but they're the most representative. So I do want to say that. Most people identified in the unsheltered point in time count survey identified as white, male, and between the ages of 55 and 64 years old. Is this surprising to anybody? Is there questions?
I have a question.
I
Did you
thought
do
so.
a comparison from year to year on this data?
Mhm. Yep. And once again, that's in the report. Okay, next slide. Okay, similarly, there is the breakdown by the housing type. And we can see that households without children were mostly identified as male. But when we look at households with children, it switches over to typically people who identify as female. Next slide.
Let me say, well,
There
the
we go.
reason I asked the question about the comparison from year to year is my interest is primarily related to the aging population, and we constantly say we feel that our homeless population is aging, so I was wondering, and you said it's in the report, I'm sorry, that wasn't included as one of the slides, whether what we're saying is in fact happening. And so I guess I'm sure have to look at the report to get the answer.
I know Anne Marie had to step out for a call, but I think that's what her whole, agency's existence is really looking at that. It's what prompted her to get more involved dramatically in terms of it, so.
But is the data showing that?
That's
I
the
think what
question.
Teresa's question
That's
is.
the
So
question.
is the data showing what specifically?
That our unhoused population is aging, and we're seeing more senior citizens 65 and above
On the streets.
are hitting the streets.
It's consistently high.
Mhm.
Yeah, so the data, yes, the data is showing that there is aging.
So it's increasing, not
That's the
as much as
question.
consistently high, but it is, you are seeing some increases.
Mhm.
Can I ask a question? Back on the map, I know it's a couple slides ago, I want to make sure I'm understanding. The number 111 for like in the area of Pinellas Park, is that,
You can zoom in further and it gets more specific, and that 111 will
because we
change.
talk about Clearwater often in St. Pete, but this number of 111 in like the Pinellas Park area is pretty
Mhm.
significant.
So the order of would it be City of St. Pete, Clearwater, Pinellas Park, the top ones.
Is it significant because in April, is it significant because it jumps out to you? Because to me, I think it should have been expected. Because we're seeing, one of the things that we've seen is populations I don't wanna say, I don't wanna use the word transient, cause I probably just haven't had enough coffee, but kind of moving more into Pinellas Park.
Yeah,
From
19,
St. Pete,
yes.
it's like, we're just seeing that more.
And if you zoom in like you suggested,
yeah,
what you find is 87 of that 111
Yeah.
is actually Lilman.
Lilman,
It's near Kenneth City and Lilman, actually south of 62nd. It's near 58th Avenue. So, Florida Dream Center's in that area.
Yeah,
They're coming for resources, et cetera. If you look at Park Boulevard, which is clearly Pinellas Park, you see that it's 18 and 6. So the majority of those that are in that 111 are actually
Kansas City.
Kenneth City and Lilman.
I mean, if you really scroll down, 49 are in Leland Park. So, like,
So
These are also the places that they were interviewed, not necessarily the places that they crash out. Right?
exactly,
Or the encampment,
exactly.
because what we're seeing is that they're staying hidden a lot better. There's undeveloped properties and on private properties and in wooded areas, that's the population is moving out of the public view.
Yeah.
They know what's coming with this.
Yeah, they do.
Right.
I was gonna say.
But we gotta remember, this count was January. all this sort of happened. So it makes sense that this population is continuing to bury themselves.
Yeah.
They're inland, they're not visible to the street for the majority of what we're finding when we go out.
And this is gonna be affected by things like weather. So for example, last year, pretty inclement weather. This year's count, pretty good weather. So there was actually an increase from last year. It's likely attributed to not only just maybe an increase, an influx of people moving to Pinellas County, but also the weather. And also, it's where they were surveyed. And if there's a whole county of almost 1 million people and there's 400 volunteers, it's something that I'm unable to answer, that nobody can actually answer. These are the hot spots, but these cold spots, does that mean that there's no people who were identified as experiencing homelessness? Or did the volunteers were they unable to get to that point?
Right.
So that's something to definitely keep in mind.
I also, last year's PIT committee chair, Dominique Randall, online wanted to note that Lealman Park, there's a special PIT event that happens there. The Florida Dream Center hosts a drop-in site for PIT surveys there. So, folks to know.
It would be interesting, and I know it's part of discussion, if each one of our 24 municipalities held something like that, a drop-in hit count or something, and that would ask people to come and we could offer services and resources and get
And so that's something that I would love to recommend.
coverage.
Just as, a researcher is an exact recommendation like that. However, the flip side is if you hold these events, now your municipality is going to have a higher count. And that may not just.
I know, I very much know.
Yeah, exactly. So sometimes it may not always be good for
But accuracy is.
For whatever reason.
for whatever reason.
The optics.
The optic, unfortunately, I hate to say that, but I mean, we're all pragmatic people here. But yes, that is something that would be important to actually have these events to get those, because once again, it's impossible to tell, is there absolutely nobody in this area right there because it's perfect and the most ideal community in all of Pinellas County? Or is there just not enough volunteers in that specific section?
Should we be concerned that it's used stuff? And the reason I say this, and Councilmember Dick Sanders will remember this too, is when we were looking on the 16th Street corridor and we were having those meetings when Glenn Wilder was doing constant feedings at the corner of 18th and 16th. And if we do events, you're gonna draw people to one spot, but they definitely don't all live right there or aren't,
I think you're right, Mike, that if you do an event like that, you're not getting a true picture of where they actually tend to hang out, so to speak.
Yeah.
And this is why this is a really key question on the survey, part of the survey. So during the count, there's a battery of questions. And you have access to that survey. And one of the questions is, what area do you stay in the most? So you may be counted, in Clearwater, but you typically spend your time in Kenneth City or St. Pete. It's not, once again,
Yeah, it's not accurate.
it's not the most accurate, but it's a measure. It is a
Is
measure.
question at least asked?
Excuse me?
Is that at least asked?
Yeah, that's what this chart is right here.
Yeah, oh, it's on the survey.
Yeah.
But to the point that many of them are transient, and
Right.
they're just gonna, I think the question is, where do you most stay? You know?
It's a frequent area of
Area
stay.
more centrally located in each area. It might keep it more of a true number rather than like the outskirts of Largo, the outskirts of Clearwater where they can cross over. So if it was done that way and it was more in the center of the location, it would at least keep people more in that general area where they're coming from, staying.
Dr. Gearhart, so I'm looking and it's.
Yeah, it's getting close. I was about to say, yeah.
Yeah,
So-
how are we doing on your slide numbers?
We're good.
Are
We're
we
just-
good? Okay,
Yeah,
for a 10-ish, we can go over a
Yeah.
little bit, but
Yeah.
just wanna keep us on track.
yeah, we did this one, so the next one. I can't remember. So, similar pattern as the shelter count, we can see that households without children mostly identified as white, and then when we get to households with children, identified as Black or African American. And then, so we'll skip to.
Well, let's not skip over that.
Yeah, because I think this is important.
This is the same as the housing inventory count as well.
Well, and the reason I said let's not skip over that, because one of the agenda items for later is about our DEI committee. And I think it's important that we see this, that the households with at least one, the families are majority African American households with children younger than, I mean, it's just pertinent information for us to keep in mind when we have that discussion. Thank you.
And of course, and unfortunately, this pattern also is with the shelter. Okay, and then the ages, I'll just, unfortunately, we have to skim through a little bit. Most people, households without children, are between the ages of 45 and 54. And then when we look at the families, these numbers really come, these people, I should say, a lot of the counts involve the children. So in previous reports, this is why I think this discussion so vibrant, is this was always classified as younger than 18 before, but this year I wanted to change it up and actually break it down by more specific categories. So most of these people, children, individuals counted are children. The next one. And then similarly, this is the chronic and not chronic. Households without children, about 5% or 28 of the count were identified as chronically homeless. 6% veteran households without children identified as chronically homeless, and then 13% in households with at least one adult, one child were identified as chronically homeless. Next slide. These are also amongst the questions asked in the point in time count survey. There's a lot of demographic characteristics asked. There's also a lot of health characteristics, mental health, substance use, jail. So I didn't want to put all of those in this presentation. These are some of the ones, the select ones that I chose. But in terms of alcohol use disorder, approximately 19% of people reported that they had this is all self-reported, mind you, as well, reported that they had alcohol use disorder. 36 reported that they had spent time incarcerated in the past year. And then chronic health condition, 37%, mental health disorder, 36%. And in the report, you can see the change over time, but essentially this is an increase actually from last year's report.
And to some extent, if you look at both chronic health conditions and mental health disorders, are we seeing it co-occurring? Is that part of what we're looking at here too?
You could select, yeah, it's not limited to one or the other, not mutually exclusive.
I'm trying to go by the numbers to see if that is, are we seeing that folks are showing up in both places?
Couldn't necessarily sparse all of that out. So we can just see, so 36% of people reported that they had a mental health disorder. They may also have a chronic health condition, jail, and alcohol use disorder. So in the raw data that's there, it's just a lot of information to put on.
And you didn't include the substance use?
Yeah, in the report, not on this.
Okay.
Mhm. So. And here's the, just the trend over time. So you can see from 2016 to now, it's been a pretty steady decrease, but from last year, we see actually the trend starting to shift upward again. It's been 1 year, so I can't make any claims to patterns or anything like that. It could be very well be because the weather was, very good this year for the count. So just, it was easier to get more people out and see people versus rainy and cold when people are gonna be hiding, or I don't say hiding, in a location that it's harder to get to.
Well, it could also be the number of volunteers. I don't know if there's like an asterisk about how many volunteers.
It's similar to
we have.
last year. Yeah, there is. It's
Yeah.
approximately 400. I think 395 this year and
Okay.
like 380, I think, last year. So similar number of volunteers, but we could, I mean, would be a discussion point that would take several hours, I think. And then I'm gonna definitely have to go through these very quickly. So this is the sheltered and unsheltered comparison. We can see just the number of persons. So most people by HUD standards there's 2,110 people. 66% of the total HUD count classification were sheltered and 34% were unsheltered. And then most of the people who were identified as chronic were sheltered. And this could be interpreted a couple ways. So probably the way I interpret that as good, people with a health condition or a serious history of homelessness are counted in the shelter. So this could be a positive outcome. So. Okay, and we could look at the different proportions. We can see, so yellow sheltered, blue unsheltered. Approximately 40% of sheltered individuals identified as Black or African American, whereas 30% were white, identified as white. And we can see a pretty similar trend across the characteristics. So we're saying that most individuals identified during the count identified as white. However, I think approximately 10% of the Pinellas County population is Black or African American. So although individuals identified as white there's a higher count proportionally, there's a very big disparity with the Black and African American population. Next slide. And then this is the jail count. This is just a map of, Lieutenant Hayes could maybe correct it, where they identified their point of last point, or where they were arrested. Where they were arrested. Right. So we can see this map, but we'll go to the next slide. Compared to the overall count of the jail population at that time, 5% did not report address at booking. And then we can see most individuals in the jail count identified as male, white, and then between the ages of 35 and 44. And here we see the trends over time. So this is clearly a sharp decrease. Right, so this is great news, but also I do want to clarify that there was a change in the methodology of how the jail count was counted over the years. So this year, we looked at people who identified a permanent or an address at the time of booking, and then took out people, for example, who were staying in jail 90 days, were maybe being sent to a state prison or another institution, whereas previously it was anyone who did not identify the address at the time of booking, but because of HUD definitions, we wanted to take out people who were going to be in prison in jail or prison during that time. So this is actually a much more accurate count compared to previous years.
Well, should we anticipate that number going up in light of our new state law?
And
I'm just saying.
Question. What event happened in 2023 that caused such a significant drop? That's almost a 500% drop.
the change
1
in
year.
the methodology of how people were counted.
And is that explained in the report as well, so that
Yeah.
when HUD sees it or whoever sees it, it's like, oh, okay, great. There you go.
So just to clarify, the methodology that we came up with was discussed at length with the Data and System Performance Committee. And everybody was on board with it as far as I can't remember her name, the previous CEO, she sat in on both of those
Yep,
meetings.
Monica.
Monica, yeah, sorry. Monica sat in on all those meetings and everybody agreed with the way that we came up with that methodology.
No, I think you're right, but I do, you're gonna get asked. It's gonna,
I would say this is the right methodology going
Yeah.
forward.
Right.
We're gonna apply the same method next year, and to Teresa's point, we might very well see an increased number, and that would indicate an actual increase. This doesn't say we have less homeless people in jail than we did last year, it just says we have a better number.
There's some questions.
what's a more accurate?
More accurate.
There were some questions online, but aren't there, Victoria?
I'm answering them. They're just wondering the same thing, about the methodology and wanting to ensure that that is explained, so.
I saw one of the comments, so I think you were the one I noticed
Yeah.
you read was the misleading nature of it. Is this misleading to have to change the comparison over the years?
Yeah, that's the one that prompted me to say there's some comments online we should be paying attention. And then, personally, that's one of the issues I have with this hybrid system. We tend to ignore what's being said, and they should have a voice. But anyway.
I do want to move on.
It's been a period of previous years if the methodology was changed, I agree.
And then to sum up, looking at the school board data, there was of the total number of people, so slightly over 90,000 students in Pinellas County provided by the Pinellas County School Board. Approximately 4% of those were identified as experiencing homelessness. And this, once again, I do want to clarify, is not a single point in time. Students may or parents may talk to a teacher, a school social worker, and say, hey, we don't have a home right now. So then they're put into the system, and that's occurred. I counted it from the start of the school year till the point in time count. So anytime somebody at the school was notified, then they were counted. So that's where we get the 3,555 people. So it's over
August to January.
August to January.
And so the majority of them are in hotels and doubled up.
In shared housing.
Unduplicated.
Yeah, they're unduplicated. And then so most would be shared housing. So staying with a friend, or other family members, a shared housing unit. And next slide. And then this is the breakdown of each of it by the gender, race, and then the ages as well. So once again, most people are in shared housing, and we can see that it's a pretty simple, and this is all ages in the report. There, I break it down by younger than 5, 5 to 12, 13 to 17, and over the age of 18. For the purposes of this presentation, this is the numbers for every single student identified here. And we can see that pretty even breakdown between male and female. And then when we look at the race, we can see that there's a higher number of students who are identified as Black or African American in the Pinellas County School Board data, who are identified as experiencing any type of homelessness, whether that's in an unsheltered, emergency or transitional shelter, hotel, motel, or shared housing.
And so this is from the school's data. Somebody in the household would have to be enrolled in Pinellas County schools. Correct. So that does not include those in charter schools, private schools, households that got kids that are not, that are in daycare or not in daycare. So again, it's just a snapshot.
Yeah, so this would be about, I think it's 92,000 students within the caveat of the
Pinellas County schools, not all these other
not all
schools.
exactly.
And the data is being reported by, it's a self-report. So this, where they're staying, for example, is a self-report point in time, but self-report nonetheless.
Yeah, so how they may, there's various routes to how this information gets to, I guess we could say my hands, which would be, there's the McKinney Veto Act, so then there's some regulations regarding funding and everything like that to get hotel, motel vouchers. So as part of that, they have to have the social workers they have for the schools will get notified by either the student who may want to talk to the counselor and just about any issue and it may emerge that, oh, they're unhoused right now. So they get counted. The parent may call the school and say, hey, we are not housed right now. Is there anything you can do to help them? So there's another method, any type of methodology, and then that'll prompt the social work team in the schools to count that individual. And that is August to January. For this, they do it the whole year, but I counted it just for that time period because that's the time period I used last year, so I wanted to maintain consistency.
We did have one question online from 2024 PIT Chair Dominique Randall.
I'm sorry. Hi, everyone. Would you mind going back one slide? I just wanted to see the overall number. You mentioned a couple of times that this school data is from start of the school year until the point in time date. Is that correct?
Until the biggest lake in North America just happened to form. And you can't stand that, can you?
I'm sorry, you can't hear.
Show you on.
I don't see anybody off mute.
I know she has a jacket. Monk, I make heroes collars myself. Right.
Freeman, the question was for you. Is this from the beginning of the school year till January, what was it, 27th? Is that correct?
Offered to help with and failed. 220. It's possible.
Sorry, Dominique, I think that might have been your background, but it was January 31st.
Okay, I can hear. So the reason I asked for that clarification is last year's count, I was under the assumption that it was until about late April. And the number was 3622. So I just found this number to be, I mean, we're counting it 4 months earlier. So again, that kind of apples to apples comparison. And then do we know what the end of year numbers were? Were they that much higher? Because it does seem like it would be a little bit higher than it could have been towards the end of the year.
I did not collect end of year numbers, so I can't answer that.
Was it the same window from January?
Same window,
Okay.
yeah.
All right, so it did not go to April last year.
Yeah, I confirmed that with the school board as well. So I said, send me the exact same time frame as last year. So if it does say that, then that would be accounted to a potentially typo. So that would be a good actually point to clarify. But it's the same window from the data people at the school board who sent it to me. Good. All right, well, I was hoping we would have the discussion for the recommendations of, we talked about all of the issues that may emerge, but I came up with 6 just core recommendations. There's, I think, a million things we could do to change the world, but in terms of Pinellas County, we see that there is a pretty large number of people with not only just behavioral health issues, but physical and chronic health conditions. So it would be very good to target street outreach efforts because there's several different street outreach teams in Pinellas County. So to utilize some sort of centralized reporting system or ensure attendance at the committees, or you utilize HMIS to actually track some of these to not only deduplicate services, but to also target services for the street outreach. Also to increase kind of along these lines is to increase access and availability to medical respite beds. I will say that in Pinellas County, there was compared to the entire United States, last year's count, there's much less chronically homeless. I think there was about 16% in Pinellas County, whereas the national average is closer to 25-30%. So this is very good. But nonetheless, I like to include recommendations to double down on the good work that's being done here in terms of addressing the chronic homeless especially with medical conditions. And then we can see, especially with the breakdown of, the children, there's a very core need to ensure that there's family support services, not just in all of the shelters, but also in the unsheltered. So once again, with the street outreach initiatives to incorporate family support. And then employment, in the report, I can see, I list out the trends of the number of people or the reasons for lost housing. And consistently, it's the employment and income related areas. So at these shelter points, There's various different techniques, including co-locating an employment specialist to when somebody enters that system. We can already start the process of engaging them in employment and vocational support services to increase opportunities to have gainful income and employment, and then ultimately stable housing. And then we can clearly see that there is some racial disparities in the not only sheltered, but also the unsheltered count. So there is definitely a need to enforce anti-discrimination housing policies when we have the excuse me, ability, but specifically, this is for racial disparities, but one of the key and under-discussed and will be a very important topic is people with a history of incarceration. So especially with this, as you mentioned, this potentially could see more people who are unhoused get arrested. Therefore, they have a criminal record. And then there's leasers, landlords, shelters may not accept people. And HUD recently released some guidelines on how to ensure anti-discrimination for people with a history of incarceration. So not just racial disparities, but arrest disparities as well.
I don't know if you saw the comment from William Kilgore, who's with the St. Pete Tenants Union, related to the point in time count.
Just for the record, so since everybody's reading that, it says independent volunteers should be in charge of the jail count, not PCSO. Additionally, there needs to be an independent study commissioned to examine the accuracy of homeless incarceration in Pinellas County.
Again, I'm gonna reiterate, I think it's important that we in the room always know what's being said by those in the virtual world, so that's what I wanted that to be.
Thank you, Teresa.
And that's a great segue to the next point is we need to coordinate these efforts with law enforcement because law enforcement is an integral part of the community and they will always be a part of the homeless continuum of care. So actually working with law enforcement, for example, the homeless leadership side of things or the behavioral health side of things can offer trauma-informed care training to law enforcement who interact. Law enforcement has introduced street outreach teams. And so there could be a benefit to not only work with these law enforcement teams to enhance trauma-informed care capabilities, also motivational interviewing to help link people identified as experiencing homelessness with support services that they need, whether it's behavioral health services, substance use treatment, medical interventions, or housing or employment, or just any type of support that they need. So integrating or at least coordinating with law enforcement is going to be ultimately an extremely important need in the community. Next. Does anyone have any questions?
Thank you so much. I appreciate it. It's a lot of work that goes into this and preparing a report and figuring out what to include in that report and to present to us. So unfortunately, I didn't have the opportunity to review what was in the packet before this meeting. And I had to step out for Paul, but you know, HUD has said that the elderly is the largest growing demographic of the growing unhoused population in the country, and Pinellas County is seeing that. So are the same graphs that you presented available for that demographic in terms of race, age, first-time homeless, chronically homeless? Is that in the report? And is there a comparison to last year?
Yes, and yes.
Okay. And did you see an increase over last year in those areas?
I have to go back and look. It's been a month since I first submitted it, but I can't say the specific numbers, but if anyone actually, maybe if they have the PDF open, there's going to be exact comparison to look at the percent increase. I think it was depending on the household type, because different, so in emergency shelters, there would be a higher increase, but in other shelter types or unsheltered, excuse me, relatively steady, but nonetheless a couple percent increase higher.
And we tried to ask those kinds of questions
Yeah,
while
'cause-
you weren't here.
I appreciate that, thank you, because I think that might be a missed opportunity. And I know that the focus on children and families is very important, but, since the entire population of Pinellas County is 30% over the age of 60, a couple of slides on that would have been helpful, thank you. But I will review the report, thanks.
There was some slides on that. Yeah. On the ages, and I broke it down not by 60, but by 62. 62 and older.
The changes I sent you were before this got out. Victoria, did the verbiage changes that I request make it in?
No, not yet. That'll be, I think the final, he sent me some,
Okay.
some stuff a little bit ago, so it was, I had already sent that over.
Okay.
I
Okay,
just-
I will get that and ensure that what gets posted includes that, yes. And make a note of that.
So with those kinds of changes, if Lieutenant Page set some changes, we have some feedback about clarification of titles and stuff. Do you want to hold off on this action on accepting or confirming the PIT report, or what would that mean for timeline stuff?
So this data cannot be released unless the board approves it. Last year, what happened was there were a couple of verbiage edits and the board approved the report as long as we worked with Lieutenant Page to ensure that the verbiage he wanted updated was updated to PCSO standards. And then we did not have to bring it back to the board for approval. It was just approved at that point. We did send it out to the board, of course, once it was updated, but it was approved pending updates from Lieutenant Page last year.
Is there a comment online?
Online, oh, sorry, go ahead. Oh, sorry, I was looking at the wrong one. I don't have that. Okay, so Arrow Online says a resident with a housing choice voucher had shared a letter she received about a COVID-related benefit ending in January 2025. Would the Housing Authority be able to provide any information at a future meeting, maybe Funders Council, as to how households will be affected and how it will affect the amount of their HCV subsidy?
That's off subject.
Yeah.
Yeah, let's come back to that.
The answer is yes.
Okay, there you go, Arrow, yes.
So any feedback on acceptance of the PIT report or final questions pending some of those clarifications, especially for the age definers in a titles, whatever you have for a section title, especially that age of 18 to 24 is classified as youth.
So I was gonna move approval with the designated changes identified here today. But there are a lot of changes.
And so I would move that we defer approval
Yeah.
of this item until the next meeting of the board of directors. And that the noted changes be included and presented to
So we
us.
just see the strike throughs on it, because I was
Second.
initially when we started,
Yeah.
I was going to move that motion, but the more we talked, the more changes there were in clarification, so, I think we need to see a new version.
I will caution again. Oh, sorry. You.
I just wanted to ask, so the report does include information on the pages about, it defines youth and whatnot in the report. So I just want to make sure that we are talking about the report and not the slides. And that those changes need to be made in the report as well. And I'm not saying they don't, I just want to clarify for our sake.
My motion would include the report as well as the slides be deferred, well, the report be deferred for approval pending the changes that have been identified and be brought back to the board of directors for approval at the next meeting. I don't know that the consultant has to be here, but we would like, as Councilmember Fix Sanders indicated, strike throughs and underline so we can see what the changes are that may impact the report itself. Did you
And I
get all
think
that?
Got it. Thank you.
And good to have that like at least 2 weeks before the next board of directors meeting, so people have adequate time to really review it. And then, Dr.
Yes.
Gearhart, you've been pretty good about allowing us to reach out to you with questions. You still open to that?
Yep.
In between, so as you review and get into the minutia, if you wanna ask questions.
Yeah, the unsheltered data, as you know, is so important right this minute, right, because of this new law. And knowing the specifics around unsheltered in particular is going to guide, I think, our task force and other things, right? So if we have whatever the number, 900, what is the unsheltered number in this report?
721.
721, 721, and understanding the demographics, the age, any number of things, because there's lots of things getting ready to happen around that group of people that we know of, right, which is the 721. Who knows what that number actually is? I suspect that number is actually pretty significantly higher. In any case, if we're trying to figure out, can our jail diversion program Safe Harbor accommodate all unsheltered people right now? The answer is no. If it's 721, and that's without even understanding the breakdown in ages. But no, the answer would be no. Could our jail accommodate 721? No, that's not the answer either. But right now, what we know in this room is we need 721 more beds than we have for the unsheltered. And so I agree. I seconded the motion. I just want to make sure that we have meaningful data that can be pulled out into what I'm going to call a one pager as we're trying to address this no camping legislation with actual numbers.
And one of the key metrics to that is it 721 more beds or how many beds were
Right,
occupied
'cause
at the
I
time?
think
We
that
need to do
that's-
the math, we need to know what that is, sure.
Because those are the 2 points because what you just said, April, is we still really, I think we're getting closer to really identifying capacity versus people who are sheltered and unsheltered, and that's the number that we're obviously concerned about, and it's not 721, it's what's the capacity minus the 721. I mean, I don't want to stick on a number. And going back to what Teresa brought up and Anne Marie reiterated, it doesn't jump out to me, and now, if you ask the question, have you reviewed it? I'm trying to keep going back through, is more year-on-year comparison. Because what isn't jumping out is what you asked, and we did have a discussion when you were on the phone, is, what's that increase? Because we all know this is here and it's gonna continue to grow when it comes to older populations, but I don't see it jumping out on the year-to-year comparison data. And I think that those are gonna be the things that we really need to kind of stay on top of.
Well, and we have to understand percentages though. Percentages can be so misleading in my opinion, because 1% could be actually a number of 60 human beings, right? And so the number 60 or whatever it is, I remember years ago, because the elderly are extremely important to many of us in this room, is, we knew of and could count, I think the number at the time was 40 individuals who were over the age of 62 living street homeless. I think that number now, last year or something, it was, we had a 400% or something crazy increase. So the percentage might look like, the graph might look like it's really, really little. But when you, as you said, with the maps, even when you zoom in, right, when you zoom into the number, these are, even if it's 5, the number's increasing, and 5 is 5 of our fathers, our grandmothers, our great, right? The number 5 is important. Whatever that number is going to be important. So, I want to be able to see that as opposed to just, so to speak, these percentages, because when we're talking about a small inn, it almost doesn't even make the graph, but there is a human behind, right, that number.
And that's a great point, because you could have a 1 to 4, which is a 400% increase, and that's 4 people, and whatever situation is, or you could have a 1% increase from 1,000 to 2,000. So we can look at that. And those are on the appendices of year-to-year breakdown with not only the number, the actual human number, but also the percent as well, with the percent increase, decrease, or if it stayed the same, broken down by household type and by shelter type.
Okay.
Oh, yeah.
Yeah.
No,
Go
it's
ahead.
just that I'm looking at the calendar, this board doesn't meet again until the 26th of September. So is there any impact of this not getting voted on for 6 weeks?
I cannot share this data and we cannot use this data until it is approved.
So calculating people's applications for things,
Yeah,
is there?
I do want to ask you a question. So these changes, they're not going to be changes to the numbers. It's going to be changes to the title. Is essentially it's unaccompanied youth and changing it to that. So it's not going to change the content, but
the numbers are what the numbers are.
the numbers are what
Right.
the numbers are.
Cause to your point, I was gonna say the same thing. Don't we need to approve this and then work
Yeah.
on it? So that we can use it?
Cindy has her
Yeah.
hand in the air.
I just wanted to
So this
clarify,
is showing that.
you guys are looking at the PowerPoint. The PowerPoint is not the report.
I'm looking at the
first
report.
page on the report has the key terms defined for unaccompanied youth.
Okay.
And this report's 144 pages long, I think.
So that
Yeah,
chart
I
was
just,
just
I
to
just
show
was
the
hoping that
decrease.
that
in
might help
65.
you decide further.
I don't know. I gotta look at that again.
Can you go back to?
Yes,
whoever's
sorry, I
showing-
wish, I wish that I noted which page it was. I apologize.
There, you can go to the,
It's, you passed it, within the colors and, yeah.
That's youth,
No.
that's youth.
It was the whole thing.
yeah, it's all
But if
households.
we approve the report today, it won't be released to the public today. You'll go through those language changes from Lieutenant Hayes, as well as the minor little things that we mentioned about clarity.
Can you
Is that
stop
correct?
scrolling?
I'm getting to the same one, Teresa. It's this one.
Okay.
And so it's showing from 2023, 166 for 65 and older, and for 2024, 143.
Total number 166.
Yeah.
And then so the 143, but then
Unbelievable.
this is all households, but then when you go down by the specific household type, there could be some changes.
That's the total for all households, and I'm
Because
just
there's so
saying
many
frankly, I don't.
decreases.
Yeah, that's what,
Anywhere near
but when you look at that, so maybe we could scroll down if we want to get super
But
specific.
again, our head count is dependent on volunteers, you know, who self-reports, who participates. I mean, it's the best people can do on one day.
Oh, I understand, I've participated
Yeah.
in the pit for years, so.
And it may be
The
a decrease,
question
but it's
is,
not
it
upward,
was
so it's
said
still.
that we
steady.
were looking at the report, that we were asking for changes to the presentation. What from the report reflects the same thing that was in the presentation? So
Every
you
single
use-
thing.
You use graphs, you use pie charts, are they in the report?
Yes.
So they need to be changed. If there is some clarity on the titles that we were asking for, then they need to be updated.
Well, that's what I was saying. So the data is not changing, but the changes to the titles would change.
And I think that that's all we're concerned with.
Exactly,
for-
yeah.
For those visuals and those titles. And if there were additional verbiage changes to strike through, I don't know how many they were. If they were substantial,
Not at all.
but, if everybody's okay with that, I think the titles were the ones that most had issues with, is being able to translate what it means.
Easily. Because
Yeah,
it does have
easily.
a glossary, right? So do you want to amend your motion?
I don't have most
So this is what that would be what, so if you could go to like.
I'll make it, I'll make it easy, I'll withdraw my motion.
So before somebody makes another motion, if you want clarification on my information, it basically says that anybody associated with the numbers coming out of county jail, instead of indicating that they're homeless, it says that they did not disclose a permanent address.
So that would be the verbiage change, and he gave that to me, recently.
6 different spots where it
Yeah.
says homeless in jail, and it just changes to did not disclose permanent address.
That seems very,
Madam Chair,
yes,
where do the recommendations go? Who sees those? What do we do with them?
with a
At the end
report.
of the,
Oh, at the recommendation.
on the slides, not the report.
Oh, those are also included in the report.
Yeah, and in the report, it has a good explanation.
They're similar to last year.
Yeah.
I think
Couple
it's a fair
differences, but
question. Well, I withdrew my motion, so, no motion on the floor, but on those recommendations that he had up there. One question that came to mind to me was when it mentions enforcing anti-discrimination laws. What does this body have in terms of being the ability to enforce those laws? We don't have any ability. Now to advocate for the enforcement of the anti-discrimination laws that exist in Pinellas County. That's one thing, but we don't have the enforcement ability here, so I don't even know personally why that would be worded in that way as a recommendation.
So that would
we do have
change
a-
to advocate for the
Advocate for-
enforcement. That would be a verbiage change,
Yeah.
because that's something that I'm gonna include in the report
Okay.
regardless.
So would we want to make a motion to accept the report with the caveat that we will review for language changes? Because the data's not gonna change.
Data won't change.
You know, if we need to use this data, we can't wait till the next board meeting to approve the report. Because it's a timing issue, and this is what we did last year too, I think, is that we approved it with the understanding that there were going to be adjustments to.
And last year, the adjustments were, once again, with the jail, just changing the verbiage. And this one would be changing it from identified at booking and then also the title of the charts, but not the content of the charts. And it won't necessarily even, can you go back up to where it says and either sheltered or unsheltered?
Let me go to this.
Yeah.
Sorry, everybody, it's a very big report.
So I did make some typos as we cut. So this is what I'd call this peer review. So this is exactly what is needed. If you can go to the actual, not the figures, but
Oh, the section,
the section where it actually has the title, because it's not actually even the graphs and figures in the report that need to change. It's the header that would need to change. So it's actually very simple to do. Yeah,
But again, I think
click unaccompanied youth households. Right here.
Unaccompanied youth.
Yeah. So I just have gender, race, ethnicity, age, but then this up here, the header would have a clarification to say what it is, or in the note.
I
It is-
think
it is
it's a
in the
header
note.
of each where it says unaccompanied youth, it needs to be ages 18 to 24 or something. For those, that confusing one too.
Yeah. So we could, yeah, but that's very easy.
Okay.
Yeah, it doesn't, once again, it doesn't change the data, just a point of clarification.
We do have quorum now as Councilmember Big Sanders. Do we have a motion on this report?
I make a motion that we accept the report as presented with the necessary changes identified today from the sheriff and the title changes.
You're writing all these down.
yes.
But do I need to put a condition that, before it's released to the public, that we receive a copy? So I guess I need to do with the condition of receipt of final version before distribution.
Okay. Sounds good. Okay. Any further discussion?
Yes, I don't mean to be a dog with a bone, but what do we do with the recommendations?
Yeah.
I mean, I didn't get an answer.
That he added.
Do we
Well,
put
we-
it part of our strategic plan? Do we have benchmarks, action items, criteria? What do we do?
People who are funders, people who are in this room, like Councilmember Big Sanders and Largo Commissioner, Donna Hoke and Councilmember Menino and others will go and advocate before their bodies, their funding bodies for action and.
But
funding
should
for
there
this.
not be some criteria laid out so they can make an effective argument?
There should, and that's one of the things, my goal is as working as CoC chair is to have strategic plan for the CoC annual that we review with annual measurable goals and actions that we, measure the effectiveness of the HLA in our organization. But we don't have those right now.
But you know what, I hear what you're asking, and it's really a simple answer. Whatever recommendations that we receive from this report, it is incumbent upon us to share that information, that these are the recommendations that came from the report, and this is how you can use it to benefit the members of CLC.
I don't disagree, but I do think that we need criteria, we need benchmarks, we need to know as a body,
What we're gonna do with the recommendations, okay,
as a body.
that makes sense.
And I tend to agree
That
with
makes sense.
Elise,
Yeah.
because I'm looking at the recommendations, it said coordinate street outreach and target support services. What are we as an
What do we do?
organization going to do? It's not just about, well, the city of St. Pete is doing this, and
Right.
it's about us coming up with some actual policies and strategies, increase access and availability to medical respite beds. We don't have them. There are various providers within our organization that do, but what does that really mean? That's the other recommendation I mentioned about enforce discrimination housing policies. We don't have enforcement ability. So I agree with her. We need to, fine tune what these recommendations are and how we're going to respond to what has been recommended from this consultant.
And partner with the advocacy committee, I would think as well.
As well as the funders. The funders, if we're gonna talk about the priority populations later, that's part of this data is supposed to help us drive that decision.
Right.
I don't know that I feel that we know what we're gonna, I guess you all have some recommendations from the Providers Council, but the providers don't, to some degree, don't drive the priority. I mean, we determine that based usually on the data that's come from this pit.
Yeah.
I don't know that we're clear based on what we've been provided.
Yeah.
Some of us have questioned, do we have aging population based on this data? If you looked at that chart, it says the aging population is going down. I don't believe it. And I know it's only a snapshot of one given day in the late part of January. But
It's funny you say
I
that,
think she
Teresa,
makes a good point. What are these?
because as I was reading through the recommendations and based on the earlier discussion, I'm like, should we not make a recommendation that we as a continuum need to really start studying or digging deeper into aging populations? Because again, that number is not going down. We all know it's going up. So does that become a recommendation? When was this report done? Like when was this draft prepared?
June.
Okay, so I'm wondering, like, thinking in the future, once we have a draft, like, make it a priority that we all have a chance to review it. And I know we got this probably a little while ago, but I didn't realize that the one link meant if you clicked into the other link to see the full report. Because then maybe we could also make some suggestions on recommendations based on reviewing it a little bit earlier, prior to this meeting, because here we are, if we still have to approve something here, so we can use the data.
But do we have enough information? Because it sounds like some folks haven't even had an opportunity to review the whole report yet.
Yeah.
You said it's over 100 pages, so I feel uncomfortable moving something forward that maybe half of the group hasn't even reviewed yet. It just feels very uncomfortable to me. I know there's a pressure to try and get it done so we can use it, but on the other side, if we get it done and we start using it and it's not accurate or we have questions or concerns, we're going in a direction that's not supported by the information and data. So as we talk about it, I have more concerns about moving forward without seeing the final draft and approving a final draft.
I agree with you, and I would say, since we're all here, we do have a quorum, we've got all of our key players and a number of them online. Meeting every other month for 2 hours is inadequate, I think. And I don't work a full-time job. I am able to meet whenever, wherever, and, a good 3 hour, 4 hour chunk of a meeting to really allow for a rich, informed discussion to make the best decisions. And I just, I don't know if we need to do a hand survey if you all are feeling that as well. And then try to do doodle polls about how we can come together. And I feel like we also need to be together in person as much as possible, rather than hybrid for these full meetings, just to be most effective. Because the people on Zoom are highly qualified and they have a lot to add. We need them here.
I thought we had already taken action on that matter.
Yeah.
Which is that the meetings were in person, that Zoom
Was just for listening.
was for listening
Yeah.
only, that
Yeah.
there wasn't going to be
Yeah.
interaction, we weren't paying attention to the
Okay.
notes, blah, blah, blah. Didn't we take action on that?
Did we?
So if we
You
took
need to-
action on that, I'm
yeah.
just trying to figure out why we continue
Yeah.
to go in a circle around it.
So this needs to be an informational meeting 2 weeks before the board sits down, before we all get in this room.
I
And that
agree.
gives the HLA and Freeman or whoever is the contracted
Mm-hmm.
person to do it next year. And if you're not at this, then shame on you.
Yeah.
And you don't get to cry
Yeah,
at the board meeting when it gets voted on.
yeah,
Yeah.
and it's a big 3 hour.
So if somebody can put that
Just
into an
have
next motion if we need it.
Yeah.
Yes, I agree with you. on
Right,
that.
that-
Well,
That this should be a workshop by itself.
Yeah. Yeah, right, we haven't,
The
we
current
haven't,
motion on the floor is to accept the presentation as presented with the pending changes from the sheriff's office as well as the title changes identified here. I hear, and that the final version will be
vetted by us.
vetted by us before distribution. So that covers. And I hear when you say people haven't had the chance to review it, but when did you get it? If we just got it today, I can understand that.
Tuesday, we got it on Tuesday,
Oh, we just got it, okay,
yeah.
so,
Yeah, I'm not sure when I was sent. I wrote this.
yeah, I didn't see it say yesterday. But, if that's a concern, I think that's something that we need to move forward with and address. But if I'm hearing, Michael and those, we need the data and we need to move forward. We don't meet again until September. We don't meet again until September.
But we can call a meeting.
Yeah, I think that's what was
You wanna
being
call a meeting in
suggested, is
between?
that
Yeah.
there be a meeting before
Yeah.
our next board
Right.
meeting to kind
Well, I'm
of.
gonna leave my
workshop
motion
it.
on the floor. I
Yeah.
don't know if there's a second.
I think there was a second.
There was a second.
You're right.
You're not gonna get quorum. And I'm not being negative, but this board struggles to get quorum
Every.
every other
And
month.
that's why I said I wanna go ahead and vote, cause we have quorum today, and we're not going to get quorum. The later we get in the year, closer to the holidays, we struggle with quorum. So if my motion fails for NICA, okay, then you can try it again later. But there's a motion on the floor.
Call the question, Madam
No
Chair.
question.
Okay, we have a motion in a second. Victoria, did you wanna?
I just had a point of clarification about the motion. When you say share it with the board afterwards, does that mean share it with the board and get approval via email, from the executive committee or?
That final version is distributed to the board, given to the
Just the-
board before it's distributed, so that gives the board time. If you see something that's not right, you can still send it back for correction before it's distributed to the general public.
Okay.
So you have the opportunity to vet what we have.
Okay, so send it out with a 48-hour deadline.
But
or
then that's
something.
individual edits that people, I don't know, that's.
We can limit it to what was discussed today.
Yeah,
Okay.
yeah, it's not something new.
Okay, sorry, thank you. I
Because
just wanted
that's
to
the
make sure I
motion,
understood.
is the title changes and what's coming from the sheriff's
Because
office.
you're gonna send a track changes so that we
Right,
can
right.
see, and that's what we're gonna be
Yeah.
commenting on. If we choose to, within the limited period of time given to do so.
Right.
Perfect. I do want to make a point about the recommendations. Sorry, 6 is a lot. I don't know what you did with the recommendations last year. But if we do vote on this and it does pass us with these recommendations, I strongly suggest that per meeting, we take a recommendation, we work on it. But a lot of work is done in advance so that when we come to this meeting, we are presenting, discussing and voting on it.
Agreed. Agreed.
So the question is recalled.
We have the question, you've got it, Victoria, it's been seconded, all those in favor?
Aye.
Any opposed?
Abstain.
Abstain,
I,
you oppose,
I oppose as well.
okay, and one abstain. There another opposed? Thank you, all right, so the motion carried, thank you, when, and
Can I just say though, to the recommendations that historically, and we really don't have leadership in the room that's been with the HLA for any length of time, except for Cindy. And I don't know if Cindy, if you want to speak to that, but my recollection is that to answer the question directly, is that the recommendations have been dropped into the document that we collectively are using to evaluate and assess the HLA, and in particular, its leadership member, the CEO. And so it's like a 12-page document. Am I remembering that correctly, Cindy? So I think getting maybe a prior document that, we've done that, we had it for Amy, we had it for Monica, we had it, so they get dropped into, much of them become action items, so to speak, for the staff of the HLA working on behalf of the CoC? To try to answer your question directly, how much of that is then coming back before the board and those kinds of things is probably a different question.
I like your answer, but still as a body,
Sure.
we need to be on board and understand each one of the recommendations and what our responsibility as a collective
Is to each one of them, right?
Yes.
And so I think it's seeing this document, which is worked on most diligently in executive committee versus here, would be helpful to get to just because I think it's a fair question, and I don't want the answer to be that the answer is nothing, because that's not completely true. It doesn't get us to where I think the lease is going. But
And also, it's not fair to evaluate the CEO and staff based upon broad brush
yeah,
recommendations.
it's not, and it isn't, and it isn't,
Right.
and it
I
isn't.
have a question, because I've just been searching my emails. Was the PIT report emailed to us?
Yes, ma'am.
I don't have it.
There was.
I don't have it either.
So
There was
it was included because the packet was so long. If I sent it out as an attachment, it would have bounced back from a lot of people. So it was included as a link in the email. So the email, there's a packet attached and it says without PIT report, but in the email, it says
Yeah,
that
if you click the
this
link, you can download it. That's okay.
Yeah.
Thank
I
you.
ended up doing, but I didn't realize that until Wednesday, that there was a link. I looked at the packet first, but didn't realize until later that there was an actual link to the report.
For what it's worth, because we're about to move to that onboard software, this will not be an issue moving forward. The packet was just too big for me to send via email. With the onboard software, the report would have been added to this meeting as soon as it was finalized and HLA approved it, and everybody could have accessed it a month ago. And you would be able to access it easily in there. So moving forward, this will be.
I'd like to make another thing for us to look at to change when we are finalizing this report. Because, and thank you, April, because that's really good information. But it is not the HLA's responsibility to increase employment and income opportunities. To me, it would be advocate for, develop policies to support,
I think if you
So-
saw the document that I'm referencing, which makes it a little difficult to
Right.
have it does operationalize the differently than this. I still don't think it gets us to where we're trying to get, but.
So I would suggest that actually be in the the way the recommendations are stated, because if this is going out to the public, if this is going out to the media, it is not unreasonable that the expectation is that we will actually accomplish these things. And I think that we're setting ourselves up for failure if we
Looking
do
back,
so.
yeah.
So, really fine tune what the potential role in a smart way, right? Measurable, achievable goals for this body. Because otherwise you're setting yourself up for failure because you don't have the authority to do these things. Thank
Madam
you.
Chair?
I think we should change. Yes, please. Oh, sorry.
So I think that these are recommendations to the continuum of care, which is to the whole community.
Yeah.
So I think these recommendations go to different places. So for instance, the income one, you're right, as a body, we don't have any power to do that. But I'll tell you, as data and system performance, when we look at benchmarks and the NOFO, that says we should definitely be keeping increase of income as a metric that we hold our providers accountable for in terms of how they deliver their programs when that's appropriate. So not in permanent supportive housing, but in rapid rehousing, for instance. So I think these recommendations go to different points. I think your idea to pick one in each meeting and really flesh out what are the actions that will move, I think that makes a lot of sense.
Yeah, and also these are recommendations for the data, so it's not a directive to evaluate a CEO. I didn't write, if I knew that ahead of time, I could have operationalized it differently. These are what the data show and what I wanted to recommend from a consultant point of view, looking at it. So not a directive to tell you guys to do, you need to do this right now. These are recommendations that I see fit to improve the county,
For
homelessness
the
in the
entire
county.
COC where we.
Mhm.
All right,
Yeah, so
Jason.
we should clarify all that this isn't a,
Action item document for the.
yeah, exactly.
So just wanted to make a comment. I agree with Sam because a lot of the committees that we are currently working with are addressing some of these recommendations. And I think if we look at each one and we take it to that committee and we work on it with that committee, we get some action items and bring it up to the board to act upon or motion or whatever it is that we decide to do. That's how we move these recommendations ahead because we are looking at coordination with street outreach. We're looking at increasing income and DSP. We are looking at, anti-discrimination policies with our task force and other advocacy committees. So I think that if we look at these and we take it to those subcommittees that we're already working on, and we create action items there and bring it to the board, that's how we kind of move things forward and start looking.
These are broad stroke brushes, so this is not, like Lieutenant Hayes said, the best idea would be to have some type of informational meeting beforehand. So we don't have this discussion now, but do it beforehand.
Kevin?
But I see a question.
Well, I mean, just as an example, on the agenda today, we have an action item for priority populations, but sometimes we have a timing issue, right? Because this priority populations has been worked on by Providers and Funders Council for the last 3 months, but now it was done prior to this PIT data. Now, I think we knew from the previous year's PIT data that we saw some of the trends that we're seeing here. But it's just an example of that action of moving to council and making decisions on priority populations that we're going to fund in response to PIT and other aspects of the COC.
Madam Chair, I would suggest we move the agenda. We have about 17 minutes left on our time frame,
Thank you, Teresa.
and we've already had a motion on this and voted.
Okay. Fantastic. All right. We have some executive committee appointments that we just need a vote of confidence from this body, and we can.
Have we skipped over the consent agenda?
Oh, I'm sorry. Yes, sorry. Consent agenda. Sorry. So do I have a motion to accept the consent agenda? Check your board meeting attendance.
Motion to approve.
Second.
All those in favor?
Aye.
Motion carries. Thank you very much. Our executive committee appointment. So we have a wonderful, we are very thrilled to have Elise Minka from Pinellas County Housing Authority agreed to serve as chair of our Funders Council. We have Michael Cretin here, who is recommended by the Lived Experience Committee to serve as a board member for that, as well as Councilmember Michael Menino, who is filling the Clearwater seat. So we can have a one vote to affirm those positions.
Motion to approve.
Second.
All in favor? Aye. Very much. All right, Kevin.
Okay, at the last COC board meeting, the priority populations was reviewed and discussed, but action was not taken on this. Since that time, this item has gone back to Provider Funders Council for further discussion with some restructuring to make it more clear. And we have also changed one piece of it, which I will outline. So this is organized, and this was committee to Providers Council approval, Funders Council approval. We are looking at this from a vulnerability risk factor perspective, which is the top part. And these are items that exist within all of the priority populations. These are items that, and much of this we've seen as trending from the PIT survey that we've seen before. So these are vulnerabilities and risk factors that we see across all populations that we are prioritizing. And then we have some specific priority populations that were based at the time on data from HMIS, as well as data from the last point in time count. And those priority populations are listed here. The change made from the last time we reviewed this was that we have changed it to just veterans. Previously, it was veterans that have come back, re-entry in the last 3 years to just straight veterans. And then we have the other populations. And our interventions for prioritization for prevention and rapid rehousing interventions. Looking for questions, otherwise seeking motion for approval.
This is coming out of.
Oh, so we just need a second.
Yes. I second the motion.
Okay, any discussion, further discussion, questions? All right, so we have a vote to approve the priority populations. All those in favor? Opposed? Yes. All right, anti-camping legislation, we're gonna.
Wait a minute, what about diversity?
Well, we switched it, we
Oh,
just
okay.
switched the order.
So I just wanted to give, thank you. I wanted to give a quick update, regarding the Grants Pass versus Johnson. I know that Supreme Court case, was decided that it determined that the cruel and unusual punishment clause in the Eighth Amendment does not prohibit the cities to enforce, criminal punishment. So one of the things that we're focusing on our next task meeting is really working on outreach, the education. I know that there is a flyer that we had adjusted and we made it a little bit more simpler for our clients that we're distributing them to. We're also looking at several different options for shelter. Is that shelter capacity? We're looking at how to improve our workflow in our system from getting a client from who's unhoused into shelter and ultimately into housing. We're looking at that. We're going to have 3 different presentations next week with different ideas on shelter. There's somebody who's going to present on Dignity Bus. There's an alternate way of shelter. We are going to introduce a WellSky mobile app that's going to assist with locating in real time our clients and how we put our clients who are literally homeless into and capture that information fairly quickly on real time, because I know that that was something that was requested. And also, we're going to have a Q&A with the Pinellas County Schools regarding the portable classrooms. There was a lot of questions behind that, so having that person there doing a Q&A would benefit everybody in the community, because there was a lot of different questions that we didn't know how to answer. So that person will be available as well. There will also be other information that was requested regarding a snapshot of if a shelter needed more capacity, how much of that capacity would it be and how much would it cost? So we're trying to create a fact sheet so that if we give it to funders, they'll kind of know, okay, this shelter can do an additional 10 more beds and what does that cost per candidate? So we're really working towards that. We're also wanting to present the shelter survey results. We did survey our lived experience committee and they went out and surveyed other clients regarding shelter stays and why they don't want to go or what is working, what's not working. So we want to present that as well. So just wanted to give you a quick update of what we're doing. And we're also going to have our HLA vice chair presenting on legal review. So we have that Q&A as well. Yeah, that's
Will we be covering the Sandy Lake, in that discussion?
You mean
The
Sandy Lake?
portable classrooms?
Yes, we will have somebody there doing
Okay,
that.
thank you.
Is Pinellas Hope participating in the task force?
Yes, okay, yes.
And do you feel like the task force members themselves individually have a pretty good understanding and grasp of the actual legislation?
From the reviews that we've been providing, I believe that they do. I think that one of the questions that comes up often is, how do we, I guess, the municipalities that may or may not get sued. I don't know if that's really clear, but I believe that the attorney, our attorney can't really give clear answers to those questions because of, I don't know, whatever situation, it's like a case by case. So I think we have an overall idea of what the rule is and what the law is and how we can move forward. But I guess the intricacies of it, we may not know.
Because I do think the intricacies are important
Yes.
as we try to move towards problem solving, specifically around things like these campsites that we would be erecting if we were to do so, that they can last for a year, that, you know, there's a licensure or certification requirement from the Department of Children and Families that I don't know that anybody's yet seen, that there's a variety of really important, nuances. And I just want to make sure that the committee, say it again?
Potential barrier.
But yes, I just want to make sure that the committee, that we believe that the task force themselves has a really good handle or understanding of the actual legislation. Right, because when we start doing things like no camping bill, or we start reducing things to, you know, these kind of, you know, insightful, you know, get you really upset, language, but we don't really understand
Yeah.
the
we can provide that.
specifics. I do think that.
Well, having Aaron Swift there
Is
from
helpful.
is wonderful. I wonder if we can get an attorney from the sheriff's office or like from a municipality, like I could ask our city attorney, David Margolis, if he could attend, or somebody from his office could attend, just to listen in and have a response from a municipality, a government here that's gonna be dealing with that legislation.
Probably be beneficial to have an attorney from the county
Mhm.
instead of the sheriff's office there. But
Okay.
I'll reach
Yeah,
out. and ask.
Could you?
I do know that the attorneys, like for the city of St. Pete and for all of our municipalities, you know, who all have an attorney, either on staff or on retainer, are addressing this issue individually,
Mhm.
right? And so, again, I think if you talk to one attorney, you've talked to one attorney. To be clear.
Right, they all
To be clear, right? So I don't know that any one attorney should be speaking on behalf of, right, because that's just not gonna be
Consistent, I
the
know.
case
Yeah.
in any way, shape, or form. I think all municipalities, justifiably so, are figuring out their strategy that makes the most sense for them. So I'm not sure how helpful that would be. I do agree that Aaron is very helpful.
Very helpful.
In his, role.
But you're gonna ask the county maybe and see if someone could
I
come
don't
to
have
the
a
task
contact
force?
with the county.
Okay, right,
Oh.
I'll reach out.
So do you want me to try to get somebody from general counsel at the next meeting? I don't-
From the sheriff's department?
Yeah,
I do think on law enforcement, I think that would be helpful because because the sheriff has reached out to pretty much all the local law enforcement agencies, and many of them have agreed to kind of work in harmony
Concert with.
with the sheriff's plan, that could be potentially helpful. Again, I don't know that from a law enforcement perspective about enforcement and
Yeah.
about all that kind of stuff, I think would be.
And we can reach out to other attorneys as well, the more input that we get, I believe.
And when you reach out to the city of St. Pete, I would suggest it not be, that it be the attorney that's specifically assigned to the police department, not. I'm seeing Helen shaking her head. but-
I'm not shaking my head.
Okay.
Just rocking.
You know, because the police department has an attorney that's separate and
Yeah.
apart from the attorney,
So
the
does
city
Clearwater.
attorney's office, so. If you're gonna be looking at this
My
through the
point.
legal lens, you probably need, in addition to the attorney for the sheriff's office,
Okay.
the attorney, and I don't know if the city of Clearwater has an attorney
Yes, we
that's
do. We have an
assigned
attorney.
specifically to the police
Yep,
department.
in the police.
I just want, go ahead.
Go ahead.
No, I was just gonna mention, that there is a flyer in the packet. This was a reduced, flyer from the previous conversations that we had. We wanted to make sure that it was simpler. There was just the right amount of information. If there's any changes, we will make the changes, and we'll also want to finalize this at the next task force meeting. Current distribution.
So the 3 presentations for next week, though, we'll get a link for those, correct?
Yes, I believe I sent out the agenda. If you did not receive it,
Okay.
I will
All
forward.
right, I think I did, because I have actually been really great about sending out a lot of things. I haven't gotten through to everything, but, and then, you mentioned dignity bus, what is that? I don't-
Yeah.
We'll discuss that at that task.
Okay.
Yeah,
Okay.
there will be a presentation on that.
Okay, all right, thank you.
Dave's on the flyer, maybe, none of the other shelters wanted to, add themselves in for the call for assistance.
Had the same,
Okay, thanks.
Okay. Daisy, diversity, equity, inclusion, DEI meeting.
Yes, during the DEI committee, there were conversations regarding bringing to the board, the recruitment of members. What does that look like?
what are the, objectives of this particular committee? What is important to the board? What does the board want to see come out of this committee? Because I think that there was some conversations regarding, what is the overall purpose? What is the action items that need to come out? What do we need to work on, whether it's policies, procedures, and also participation? I know that that's been a big question within that committee. So that's something that they wanted me to bring over to this meeting to discuss just the purpose, attendance, and also any other ideas that the board wants to see.
So as a representative of that committee, and I believe the only current board member who is on that committee.
I am as well.
Oh, I'm sorry, I apologize, Ross.
No problem.
We clearly need some guidance and direction, and support, and commitment. We have consistently had an issue establishing quorum, and there's only 8 members. Which to me is a sad commentary, but even when we do get a quorum, like the last one, we had a quorum, we're sort of floundering in terms of what our role and purpose is. We need some guidance and direction, and I believe commitment on what we should be doing. At this point, the only members of that committee are individuals from government entities, and there's not, I don't believe, one service provider other than the housing authority is represented, but again, that's a government entity. I have concerns that there may be some concerns from the providers, particularly related to the current political atmosphere in the state around DE and across this country, but mainly in our state, related to the issues of diversity, equity, and inclusion. And if they're scared to have staff or themselves participate because of their fear that they may lose state funding. And if we don't have a purpose, although our data clearly shows that we have inequity and disparity in our system of homelessness, then if we don't have any clear direction, then disband us. Why are we coming? We had a study that was done 3, maybe 4 years ago by Dr. Susie Patterson, and bless her heart, she has stepped up to chair that committee. But even she, I think, is a little frustrated that we don't have a commitment beyond the 2 board members that are here, as well as no clear direction on what we should be doing to address what we see in our own data is a disparity and an inequity and an exceptionally large number of African Americans who are in our population of the unhoused, families in particular, and we are going to continue to see an aging population regardless of what that pit showed. So I said I would speak up at this board, and if you don't see a purpose for us, then, and I'm not certain if the charter shows exactly what, and I don't want us to be a committee just to say we have a committee and that HUD will give us more points on the NOFA because we have a DEI committee. Because that's the way I think we are existing right now. I know we get extra points on the NOFA. Am I wrong on that? I think I'm correct on that. But we don't want a committee on paper just to say we have a committee.
Well, originally, when we started meeting as DEI, we did get together, we did have a good showing. And we were able to pull together the board toolkit that we were able to present when, we're looking at organizations when it comes to funding to see how the board was made up. It's like if we're providing funding to different organizations, what does their DEI look like organizationally? And so that was an outcome of the first iteration of DEI. And I think as we progressed and as Amy left and CEOs changed, then that whole direction of the political environment surfaced. So we had a lot of organizations pull back. The reason why I stopped is because I couldn't keep coming with no form. And we weren't able to get anything accomplished after that fact because we didn't have a set direction. To your agreement, Ms. Jones, we kind of lost it once the governmental piece came to play and people started coming for the fear of like, and even more so, it's even more real now than anything. With that scare of government participation and them targeting nonprofits that are in that. So my recommendation would be, I don't think we need to disband it because DE&I is real. We need to have advocates. I don't mind. I just don't like to waste time. I don't like to come to meetings and we don't have a quorum. But I don't think that I don't think we need to disband it. I think we need to narrow our focus as to what issues and what that really looks like. So we now have, that could be one of the recommendations from the peer report. Now we see what that issue is. A handful might not need to be 10 people, but you have a 5 committee member, so you'll get the quorum to focus on, okay, from the PIT report, this is what we need to focus on. And
Well, the
what that
PIT,
looks
you know, the recommendation that might be appropriate, that may be, related to DEI is related to enforcement of anti-discrimination in housing. And the one person, we have the director who is from the Office of Human Rights from Pinellas County on that committee and hasn't been in a meeting for months.
Right.
Even if he's not, he hasn't participated for at least the last 3 months, even virtually. So we had suggested to staff that they reach out to Jeffrey Lord to see if he still has interest in participating on that committee, or if he'd like to assign a staff member to participate. But to simply have a meeting to advocate for enforcement of established law that's on Pinellas County books and been there since the 70s, I don't think that there's a reason to have a committee to do that.
Yeah, I think we just need to find a better purpose.
And I hear you, Councilmember Vic Sanders. I don't like to waste time either, even though I'm retired. And, you know, showing up at a meeting, and we don't necessarily have quorum, and then when we do have quorum, we're sitting there, not certain of our purpose.
Right.
That doesn't sit well with me,
Yeah.
you know, because I could be out playing with my flowers. I'm a candid person, I don't like wasting time. That's why I called for a point of order when we started this meeting. We don't have, and I sent an email to y'all before we even got here the other day saying, do we have an in-person quorum? I also, you know, so I'm just saying that we need some clear direction. I think that our chairperson, Dr. Susie Patterson, would appreciate that. Are we to be there and there were recommendations from that report that was done. I won't call it a disparity report, but we did a race equity report for this organization. And I'm not even certain, and that partially drove the establishment of this committee. And I know, as I mentioned earlier, the NOFO, we get additional points for having it, but if we ain't got a real purpose, then I'm gonna reiterate it, then we need to disband it. And if we don't have providers, I think need to barely be a part of that discussion. And if they don't feel comfortable because of the current atmosphere and the threat of possibly losing their funding, then let's disband it and maybe have those voices that are at that table participate in the lived experience, folks. I don't know what the real answer is, but you can clearly hear the frustration in my voice.
But we get your frustration, I do. We can't ignore, as Councilmember Pig Sanders, it's not that whether we want to or don't want to, some of us have in our contracts that we cannot.
Yeah, I
You know, with our state contracts, and the political environment has shifted. The nonprofit CEOs, we had a whole thing about this with NLC, where we probably had about 30 nonprofit CEOs in the room discussing this exact thing. It's not a scare thing, this is the reality of doing business in our current position.
Yeah, and you know, and Mike, I also know that there are local contracts that require that you provide information about diversity, equity, and inclusion, and you get points on that for that funding. You know, what's the composition of your board and your staff? And some of those were the issues that came out in that racial equity study that we had. So, you know, I don't know that the answer will be achieved today, but I would lean toward making a motion to disband that committee and fold it into your advocacy committee or some other committee. And certainly those of us that have in our forefront of our brains about diversity, equity, and inclusion, will still be strong voices within those
Yeah,
goals.
and I think that's, we're here is, do we just,
Yeah.
is it solved by just changing the name of it? You know, or folding it into a different committee, because it's not a question of whether we want to participate,
Right.
we can't participate.
Yeah.
I think part of advocacy would be a good fit. I mean, we can think about that. I think what this continues to illustrate and all the discussion that we've had today is how nuanced and complex everything you all do is and the CoC encompasses. And we need more than 2 hours every 2 months. And so I'd like some feedback, if you can show of hands, how many of you are willing to minimally extend the meeting time by at least an hour or meet more frequently? Anybody
I'm
open
willing
to
to
that? I
extend
think it
the,
would be a good idea.
extend the time.
Extend the time?
I would make a motion to do
But I
that.
think
Yeah.
we'll get more accomplished once we get rid of the Zoom part of it,
Yeah.
and we have more people.
Yeah.
in
Here,
person.
I think that's,
Well,
well, and
10
that's,
years ago, when I got on this committee, we met every month for 3 hours.
yeah,
And we had 40 people,
Wow.
30 to 40 people.
I mean, I
And
just, yeah.
each change of, I guess Susan was our CEO then, and Sean was our chair, or Amy. But it's like with each change, I watched it dwindle and dwindle,
Fraction,
yes,
yeah.
and I know that I
And
missed 2
COVID.
meetings in a row. Because, and even though it was 2 months apart, but when you meet every month and have a greater amount of people and meet your quorum, it gives you a little bit more flexibility. Maybe not meet in July because that's when everybody seems to go on vacation, and I think is a players month, but I just feel like we
We
as
need
a
more
whole, we've
consistency and
gotten, it's just
momentum.
so hard to
Yeah.
get things accomplished. Like, you know, even today, I was supposed to leave at 11, but my 11 canceled, but I knew we were gonna run over because of
I
what we
know.
had on the agenda today, and it's important, everything that was on
Yes,
here
it
today.
is. It's all important.
I have a
And I
question.
just feel like
Yeah.
we need to extend either more meetings and longer time or both.
Yeah.
And we need to keep as many people involved as possible. When we were talking about committees, Michael Gelazzo and I were both on advocacy committee. I was driving to Allendale Church and we get there and there'd be 3 of us. And it was like, okay, I took the time. Yes, I work for myself, but I have a lot of deadlines with my job and the city, but I'm there, you know?
Teresa,
My question is related to the executive committee of the board. Is some of these items that we sort of drill down real deep into the minutia on, are they discussed by the executive committee first? And if so, why does the executive committee not come forward with a recommendation for ratification by the full board? I'm not clear what function our executive committee fulfills. I'm not certain that I understand that, the hierarchy, so to speak.
we have not considered that at a meeting, but I think we should. I mean, we look at recommendations from the providers, the funders council, but I think we can do a better job as bringing recommendations to this.
Well, I sit here and think about
For
how
changes,
our city
yeah.
council functions. They got all of these subcommittees, they go over stuff first and drill down and get all of the kinks out, so to speak, and then they bring it to the full council for, I hate to use the term ratification,
Right.
but in effect, that's what it is.
Right.
So,
So
anyway,
Ms.
the
Jones, I was
motion,
thinking the same thing when you were talking about the executive committee, but we do. Members can attend executive committees as well. No one is banned from coming, and it goes to that same situation of you don't know what you are doing. I say that all the time.
yeah, and I don't even know when they.
So even as the executive committee, this conversation now is extremely valuable and it's helpful. So now we have something to move forward with on the executive committee when we're establishing the next agenda to address some of the concerns from today. So I think it's a good start to answer your question. But still, on the executive committee, I don't think we've ever not allowed anyone to attend to executive committee. So, everyone is also welcome to that as well.
But it's good to get a feel for your comfort level with meeting longer, or more frequent. Yeah.
If we want to do that, can we discuss as a group another location? Sometimes it's really difficult for my team to come in here because the doors are locked and nobody's available. Is that something that we would want to consider if we're going to meet more frequently and longer time? Because I believe that the space is going to limit us on the time that we can meet here.
I have a meeting this afternoon actually with Mike Sutton, the CEO here, so I can certainly ask him if that will be a barrier or
Yeah.
problem.
Hey,
Because
Sean-
Sean's not on the meeting? He's not on virtual?
I don't.
Let me see.
Sean, you
Let
can't.
me see if he joined. Oh, you know what? Sean did actually join us. Would you like me to ask? I mean,
Well, I would.
oh, Sean says Sean says not an issue. I did receive an email from Habitat noting that we could not meet here after 2 p.m. moving forward, just so you're aware of that.
Is this a central location for everyone?
It's
Pretty central in the county.
central. to the county.
And the parking's good.
Okay.
The city of Largo has always offered, we actually had set aside for like 5 months of meetings, in our Central Park Performing Arts Center. And I think we did it there, we did it there
We did
once.
during COVID and stuff.
Yes, so it's always an option and it's available.
Well, I appreciate that feedback, so we will get on,
Is this, you were looking for a motion to extend the meeting to 3 hours?
no, I think we'd rather do a poll, the executive committee will finalize some suggestions and do a doodle poll and ask about that. I mean, I don't think we can make a motion today to change it. I mean, and I don't have the dates or anything to start. I just think general
We
feedback.
wouldn't be changing the dates, we're just be extending this meeting
Oh,
out.
extending the meeting.
And there is a motion.
More frequent than extend, or just extend?
One or the other, Ross,
Yeah.
one or the other. Okay,
Make a motion, yeah.
Sorry.
I'm making a motion to extend the meeting out.
okay.
Second.
Second,
But we're still meeting every 2 months.
yeah.
But
And that's not addressing what the original concern was.
What
To
you
me,
say?
it's like it's too much time in between
Well,
to
it's
get
too
things
much time.
accomplished.
That was
I mean,
it.
like, that's the whole
Extending the
reason.
meeting time is better than more frequent. That's
No.
more time for the issue, rather than breaking it up in little pieces.
Sometimes it needs to be both.
I think it needs to be.
Agreed.
I think it's a mixed bag. I think that when we went to every other month, it's because when we were meeting every month, we didn't need to meet every month. I think that sometimes there's a lot of stuff going on. And we always said we could call for emergency meetings if we need to. And I think that if we extend the time, that's great, but let's not try to always use it if we don't have to, like, we don't.
Right.
You know, cause I just know that that's where we're gonna run into, right? That's kind of why we did it. If I remember correctly.
Stan?
I feel like one of the other challenges we run into, to Ms. Jones' point about committees in the city council, is our committees haven't always been as strong in terms of clear delineation of what work they do on behalf of the board to vet things ahead of the board meeting. It almost feels like the committees work on parallel tracks or separate issues. Obviously, funders and providers is an exception to that. You all have a really clearly developed agenda. Your work flows directly into what we do as a board. Diversity, equity, and inclusion is having some challenges with that. Data and system performance, I think we talked about data and benchmarks. That's clearly defined, but it's parallel. It doesn't chew up any of the things that we need to talk about to the board so that it can come in a more direct fashion. So I don't know if there's need to think about what our committees do and how they function. I think that would also come with more forceful mandate that members of the board are on a committee. That speaks to the time commitment, which is already a challenge for all of us.
How about this? How about if I set a time for a meeting of anybody who's interested to have a discussion, like a workshop about the flow, the committees, the engagement, the direction, the goals, all that stuff. And we can sit down and weigh in and try to shape a recommendation, just for whoever wants to participate. You guys okay with that? All right, I'll set something up and we'll do a doodle poll with that. And yeah, Teresa?
I'm still gonna advocate for doing away with hybrid meetings.
Okay, well, yeah, I think it's our understanding that should have been.
I think as long as you've got the ability to participate on Zoom.
Yes,
If we continue to have that, I'll sit at home and drink coffee and
yeah,
just
Right.
listen to y'all. not that I'm critical to be in the room, but I just, I don't think that that's it. I don't think we have to have hybrid
Okay.
meetings anymore.
Okay, fine, we won't.
Yeah, but we've already taken action on it, right? So we've got to,
Follow
stop.
through
Yeah,
with what we've got.
Right.
Yep. Okay,
Thank you.
Get a motion on the floor?
And that's for all committees.
nope,
And meetings.
yes,
Oh,
I
Sorry.
wouldn't agree with that. I think that was just this one.
Yeah.
right?
For the charter, and I'm not the attorney, but my understanding of the charter is that the board meeting, is one of the meetings that does not allow virtual attendance to count towards quorum, and it's supposed to be one-way communication. Providers Council is also like that. However, the charter does allow individual councils and committees to make that determination.
do you want to eliminate the one-way as well?
I'm sorry.
Do you want to eliminate the one-way? The listen-in only version? They are recorded, people can watch them.
You can watch them. I mean, I just, maybe it's just a personal issue. I just don't like these hybrid meetings and we got board members that are on there that could be in this room with us and adding to the discussion. If they're just listening in, they don't get
We're
a
losing
chance
their
to,
voice, yeah.
right, we don't hear their voice, so why are we have them
Okay.
like board members?
All good, okay, we don't have any motion for.
We have a motion on the floor, we have a motion on the floor to adjourn the meeting.
We don't have.
We don't have a quorum.
We lost the
We
quorum.
do.
We still have quorum? Okay,
We do?
Victoria said we do.
2, 3, 4, 6,
We
7,
lost
8,
one
9,
here.
10, 11,
We
12,
lost
13,
Ariana.
14.
We have it?
We have 14.
Okay. Motion in a second to extend the meetings to 3 hours, the ones that are on the calendar. All in favor? Aye. Any opposed? One. Okay. Well, thank you very, very much. I appreciate the robust discussion, the nuanced discussion. I know it. I want to get rid of the feeling rushed, and cramped, meetings. We need to do better with that and.
For the record, is there any public comment?
Victoria,
public-
will what they've been saying in there be added to the minutes?
We add anything that gets publicly discussed to the minutes, not every
Like
single.
some of this stuff up here is not publicly discussed. I'm not clear.
Anything that gets verbally said in the room gets added to the minutes in the room.
But not what's on there.
No, ma'am, I don't add that unless we bring it up in the meeting. I don't add that to the minute.
Yeah.
I can, Teresa, I can send it out. I can send it out if you want to. You can have it.
Yeah.